Bismillah ar-Rahman ar-Rahim. This is the rapid revision for the data show first term second year. We will start by the oral cavity, and this is a picture for the section in the lip. This surface is the mucous membrane formed of non-keratinized stratified squamous epithelium. And this is the labial glands, which are mainly mucous glands. And this is the skeletal muscle or orbicularis oris. Second slide, to differentiate between two different types of papillae. Here we have the conical shaped papillae, which is the filiform papillae devoid of taste buds and partially keratinized. And this is the fungiform papillae, broad at the top, narrow at the base, and it is devoid here from the taste buds at the side walls. We cannot see taste buds at the side walls, and of course we know that it is projecting on the surface. However, the most important feature is the shape, and no taste buds are present at the side walls. This is the fungiform papillae, and this is the very popular papillae, foliate papillae, and its lining epithelium is the non-keratinized stratified squamous epithelium, characterized by the rectangular shape and the two parallel epithelial ridges alternating with connective tissue furrows. What is the red arrow? The red arrow here is pointing to the taste bud. The yellow arrow is pointing to the connective tissue furrow, and the blue to the epithelial ridge. So this is a ridge and a furrow. The ridge is formed of epithelium, while the furrow is formed of connective tissue. We have alternating ridges and furrows. Connective tissue, epithelium, connective tissue, epithelium, connective tissue. And this is a very famous papilla, which is the circumvallate papilla. Its lining epithelium, of course, is a non-keratinized stratified squamous epithelium. It is not projecting on the surface. It has the same shape as the fungiform, broad at the top, narrow at the base, but it is surrounded all through with this valley or groove. So what is the red arrow? It is the valley. What is the yellow? It is the taste bud. What is the blue? It is the von Ebner serous glands. Von Ebner's serous glands present here in the connective tissue under the papillae, circumvallate papillae. Now we will move to the digestive glands, starting with this picture. Identify the type of the acini. These are all serous acini because they have rounded nuclei, narrow lumen, as you will see now in the second question. Mention two visible criteria. It is narrow lumen, small in size and narrow lumen, but the narrow lumen is very evident. Here it is a lumen and this is a lumen. These are the lumen, these are the lumina, and it has a basophilic granular cytoplasm. The granules actually here are acidophilic zymogen granules. The yellow arrow points to the famous striated duct. This is formed of cuboidal epithelium with a rounded nuclei, as you see, and acidophilic cytoplasm. You cannot see the striation in some of the slides, but it is present for the cause of their presence is the presence of the mitochondria at the base forming these striations. These are the criteria for this striated duct. They have the rounded nuclei, the cuboidal epithelium, and the acidophilic cytoplasm. The yellow arrow points to the striated duct. Name the cell pointed by the red arrow. It is the fat cell, which is very common in this gland, which is the parotid gland, formed of purely serous acini, and these of course are blood vessels. Now this is the red arrow points to this, of course, a typical serous acinus with a basophilic cytoplasm, the rounded nuclei here, and the granules here cannot be seen to be acidophilic. It is granular basophilic cytoplasm, and the black arrow to the fat cells, yellow arrow to the famous striated duct with cuboidal epithelium, rounded nuclei, and the acidophilic cytoplasm. The green arrow points to the mucoserous acinas. This is the green arrow, and this is the mucus which is vacuolated, wide lumen. The serous is narrow lumen, the mucus of wide lumen. The serous have a rounded nucleus, the mucus have a basal flattened nucleus, the base and flattened. And here we have the mucus acinus or the mucus cells. Here the green arrow, mucoserous, because here we have the mucus cells and we have a crescent of basophilic darkly stained cells, which are serous cells, forming the crescent of gyanosis. So the black arrow points to the red arrow points to the serous acinus, the black arrow points to the fat cell, the yellow arrow points to the striated duct, and the green arrow here points to the mucoserous acinus. Also, this is a mucoserous. We have a crescent of gyanosis on the top of the mucus acini. But here we have serous acini, purely serous acini. Now identify this gland. In this gland you can see that we have the serous acini, we have mucus acini, we have mucoserous acini. So this is the gland which is called submandibular gland. And here the yellow arrow points to the striated duct, and the black arrow points to the basophilic acini formed of basophilic cells, rounded nuclei, so it is a serous acini. Yellow star points to the mucus which are vacuolated, and the nuclei are basal flattened. Here we have mucus acini, and the red arrow here points to the crescent of gyanosis or the serous demilune surrounding this mucoserous acinus. We have the serous demilune very evident here, darkly stained basophilic cytoplasm surrounding the vacuolated cells in this acinus with wide lumen. This is a mucoserous acinus. Number 4, we have this field shows the parenchyma of what? It is the parenchyma of the pancreas, of course, showing the endocrine portion and exocrine portion. Identify the two components and the function. This is the islet of Langerhans secreting the hormones insulin, glucagon, the most famous, and we have here the pancreatic acini secreting the pancreatic enzymes. Here we have a section in the pancreatic acinus, and the black arrow denotes what? Denotes the centroacinous cell, which is the first part of the intercalated duct, and the yellow arrow points to the lining cells itself, اللي هم characterized by zymogen granules inside their cytoplasm, and the nucleus is rounded but more near to the base, not central. This is the zymogen granules in the acinar cells. So this is the granules, zymogen granules, acidophilic zymogen granules in the pancreatic acinar cell. And this is of course the lumen. This is the centroacinous cell. Now this the picture for the liver, characterized by this central vein and the blood sinusoid and the hepatocyte. The black arrows here, excuse me, here we have the black arrows points to the blood sinusoids, showing these RBCs, the spaces between the hepatic plates. And here we have the yellow arrow points to the hepatocytes, and the arrowhead points to the central vein containing here remnants of blood. Now this is section also in the liver. The the black arrows denotes or point to the von Kupffer cell stained with vital stain as trypan blue, and the yellow star the central vein, the red arrow the blood sinusoid, and you can see here the neutrophil in the blood sinusoid and lymphocyte in the blood sinusoid. This is the typical blood sinusoid, and these are the von Kupffer cell in the wall of the blood sinusoid taking the vital stain of trypan blue, and this is a central vein. These are the hepatocytes. This is a section in the gallbladder because it shows a highly folded mucosa, just a folding of the mucosa lined by columnar cells with basal oval nuclei. And here we have the lining epithelium is simple columnar epithelium, and the columnar cells are capable of secretion of mucus in addition to absorption of water to concentrate the bile. The blue star indicates the musculosa, smooth muscle fibers in different directions, forming the musculosa layer of the gallbladder, as we don't have muscularis mucosa or a submucosa. Now, identify the pattern of organization. Here we are connecting 3 central veins, so it is a triangle. It is the portal lobule. And the liver cells in this lobule are here sharing one bile duct in the portal tract, sharing one bile duct, carrying the bile from this area of the liver tissue. Now, identify the area of the liver indicated by the white outline. This is, of course, the portal tract. The yellow arrow points to the bile duct, characterized by the lining epithelium, cuboidal cells, cubical cells with central rounded nuclei, here very evident, and the black arrow here points to the branch of the hepatic artery, and the arrowheads points to the branch of the portal vein. Thin wall, wide lumen, thick wall, narrow lumen. The lining epithelium here with the rounded nuclei can be seen. Let's start with the digestive tube. This is a picture for a luminal organ, the organ having a lumen, and this is a lining which is thick, formed of many layers of nuclei, so it is a stratified squamous epithelium. This means that I am in the esophagus. The organ here is esophagus. Type. Be specific, you should mention the species. These are mucous glands, so it is esophagus of dog. The epithelium pointed to by the red arrow is the non-keratinized stratified squamous epithelium. The layer indicated by the yellow line, it is the mucosa, formed of the epithelium, lamina propria, and the muscularis mucosa here is interrupted by the ducts of the mucous glands. What is the layer indicated by the black line? It is the submucosa containing the mucous glands, mucous esophageal glands. What is the layer indicated by the blue line? It is the musculosa, formed of inner circular and outer longitudinal layers. The yellow arrow points to mucous esophageal glands, while the blue arrow points to the duct. يبقى هنا ده الجلانز نفسها mucous esophageal glands, and this is the duct of this gland. Another slide, which is a hollow organ lined with non-keratinized stratified squamous epithelium, so it is esophagus, but here we don't have mucous glands. We have this red circle surrounding the epithelium, formed of smooth muscle called muscularis mucosa. So this is section in the esophagus cat. What are the structures pointed to by the yellow black arrows? Yellow, it is the non-keratinized stratified squamous epithelium. Black, it is the muscularis mucosa. The red star lies in the lamina propria of the mucosa. Lamina propria of the mucosa. While the black one lies in the submucosa. The layer limited by the green line, it is the inner circular smooth muscle, and this is the outer longitudinal smooth muscle of the musculosa layer. Now it is a junction, because there is a change from one side of the slide to the other. This part is different from that, so it is a junction. We have two junctions, the gastroesophageal and the pyloroduodenal. Very easy to diagnose the non-keratinized stratified squamous in one part of the slide. So when you see this non-keratinized stratified squamous epithelium, it is a gastroesophageal. When you don't see this epithelium, it is the pyloroduodenal junction. So this is the side of the esophagus, and this is the side of the stomach. The section is in the gastroesophageal junction, stomach, esophagus. The glands outlined by the black circle, they are called the esophageal mucous glands. They lie in the submucosa. These glands are lying in the submucosa. Their type is compound tubuloalveolar. If you don't mention here mucus, you should mention here mucus compound tubuloalveolar. So it is mucus as regards the type of the secretion, compound tubular alveoli as regards the shape of the secretory part and the branching duct. Here we have the glands outlined by the red circle. It is called the gastric or funding glands. They lie in the mucosa layer. يبقى هنا الجلانس في الميوكوزا وهنا الجلانس في السبميوكوزا. And this is drawn in your book as the gastroesophageal junction. You can see the fundic or gastric glands and the mucous glands. Here we have a section in the fundus because we have ducts and a gland, and the ratio between the duct and the gland is 1 to 3. This is 1 and this is 1, 2, 3. So this part is 1/3 the size of the gland. This part is the ducts carrying the secretion. They are called gastric pits, and this is the body of the gland. So this is the fundus of the stomach. The black arrow points to the pits. The black line traverses the mucosa. All of this is the mucosa from the start till the end of the muscularis mucosa. The black line traverses the mucosa layer. The cell pointed to by the yellow arrow, this is the parietal cell, which is having a acidophilic cytoplasm and a rounded nucleus, secreting the HCl and intrinsic factor. While the one pointed to by the red arrow, it is the peptic cell or chief cell, secreting the different enzymes, pepsin and renin and lipase. The blue star here the blue star, here the blue star. You should take a look at the both pictures. If it is not evident here, you can see the other one in the other picture. It is lying in the muscularis mucosa. So this is the pit, this is the gland formed of parietal cells or xanthic cells, and the chief or the peptic cell, acidophilic, basophilic, and this is the muscularis mucosa. All of this is the mucosa. Now this is another picture showing also ducts and a gland, but the ratio is 1 to 1. So this is the pylorus of the stomach, and this part is a magnification of this mucosa of the pylorus. So this part is magnified here. So the section is in the pylorus of the stomach. The letter P represent the gastric pits of the pylorus, while G the glands of the pylorus, whose type here is what? It is coiled branched tubular. Take care, those of the fundus are simple branched tubular, but those of the pylorus are coiled branched tubular, so that various sections can be seen in the body of the gland as they are coiled. The MM represents the muscularis mucosa. The blue line traverses what layer? It is the mucosa, of course, layer. S here representing the submucosa and the inner circular of the musculosa, the outer longitudinal of the musculosa, and of course you can see that the inner circular is much thickened to form the pyloric sphincter. Now there is a change from one side to the other, so it is a junction. Now you cannot see at all the non-keratinized stratified squamous epithelium here in the mucosa, so it is not gastroesophageal. By exclusion, it is the pylorodduodenal. Also, we have additional criteria. We have the much thickened muscle at the region of the pylorus to form the pyloric sphincter. We have here the different striations of the pits, and here we have the crypts and the villi. So all through the mucosa it shows striations, no stratified squamous epithelium at one side. Now this is section in the pylorodduodenal. Name the abbreviations. S here it is for the stomach, D it is for the duodenum, PS pyloric sphincter, G it is the Brunner's glands, which are mucous glands not completely evident in this picture, which are characteristic for the duodenum, and this is the inner circular muscle and outer longitudinal, and it is much thickened here at the pylorus, the circular muscle, to form the pyloric sphincter. Identify this organ and be specific. Now, this organ is showing villi projecting on the surface and tubules invaginating downwards. So this is the crypt and this is the villus. We only have two slides having villi and crypts, which are the duodenum and the ileum. Now, how to differentiate? By looking here. You can see the mucus Brunner's gland, so it is the duodenum. So this is the villus and this is the crypt, and this is the muscularis mucosa, and this is the Brunner's mucus glands, and this is the musculosa. And what is this part? It is the pancreas coming very close to the duodenum in the slide, as it is closely related to it. So identify the organ, it is the duodenum. Identify the structures by the green, it is the villus. Tissue here projecting on the surface, no cavity inside, but the white areas are surrounding these villi. And the red, it is the tubes with the cavity inside. These are the crypts. Yellow, it is the muscularis mucosa. Black, it is the mucus Brunner's glands here secreting mucus. And we identify here the muscle layer, inner circular, outer longitudinal, and finally the pancreas. Identify this organ. This organ is showing also villi and crypts, these fingers and these tubes. So it is in the small intestine. I cannot see the Brunner's glands, but instead I can see the lymphatic tissue here. So it is the ileum 100%. What are the structures pointed by the black? It is the villus. By the yellow, it is the crypt. By the white, it is the lymphatic follicle forming the Peyer's patch. Identify the layer marked by the green. Here, this is the inner circle and this is the outer longitudinal. And if we have a line traversing all this area, it is the musculosa. So this line here, it is carrying or taking part also of the outer longitudinal. You can say it is the musculosa formed of inner circular and outer longitudinal. 1 and 2 are two sections in the lower part of intestinal crypts. But section 1 here shows the crypts of the small intestine. Why? Because I can see Pannis cells with the acidophilic zymogen granules at the top of this cell. So this is the Pannis, so this is the crypt of the small intestine. And what is this? It is the goblet cell here. And what is this? It is the muscularis mucosa. Here also we have the muscularis mucosa, we have the crypts, but here the crypts are devoid of Pannis cells. They are full of many goblet cells. Here you can see 3 or 4 in this crypt. Here we can see much more of these goblet cells. And here we have Pannis. Here we don't have Pannis, so this is the crypt of the large intestine and this is the crypt of the small intestine. Section 1 shows the crypts of the small intestine and that of the large intestine. Identify A, it is the Pannis cell. Mention its function. It secretes the intestinal enzymes and the intestinal lysozyme, which is an antibacterial substance. Identify the cell marked by the blue arrow. It is the goblet cell secreting mucus for protection and lubrication. Identify the layer by the yellow line. It is the muscularis mucosa. Now this is section also in intestinal villus. Identify the cell A. It is the enterocyte or columnar absorbing cell. And this is the goblet cell. Identify A and B. Identify the layer marked by the red line. It is the core of lamina propria inside the villus. Core of lamina propria inside the villus. Now we can see here, this is the brush border of the enterocytes due to presence of a lot of microvilli to increase the surface area for absorption. And also it is provided with a coat containing the different enzymes for the final digestion of proteins and carbohydrates. And this is the goblet cell with the basal part cylindrical, apical part expanded. And that's all. Now this is a section in here large intestine, because we have crypts only, we don't have any villi projecting on the surface. And also in this picture you can see the tinea coli. This section in the large intestine, the red line traverses the mucosa, the blue arrow points to the goblet cell, the blue star lies in the lamina propria, the red arrow points to the muscularis mucosa, the green line traverses the musculosa formed of inner circular or outer longitudinal, the blue line lies in the musculosa, which is formed of inner circular, and here the green arrow, it is the outer longitudinal, but you should mention its name. It is tinea coli because it is interrupted and present in the form of 3 bands. This is one of these bands and it is called tinea coli. Now here we have crypts only. We don't have any villi, but we have lymph follicles. So this is a section in the appendix. Of course, this is human appendix because we don't have inverted Y-shaped crypt like that of rabbit. And what are the layers traversed by the yellow? It is the mucosa, it is the submucosa, it is the inner circular, outer longitudinal layers of the musculosa. The yellow circle surrounds the lymphatic follicle. The inflammation is called appendicitis, اللي هو التهاب المصران الأعور. Now we will move to the last portion in this revision, which is the eye and ear. Starting by this picture, it is the eyelid, characterized by the presence of these tarsal or meibomian glands. And we have the follicles at the margin, which is the following carrying the lash. Now, the structure, it is the eyelid. The black star denotes the skeletal muscle, which is called orbicularis oculi. And here we have the green arrow for the skin and the yellow arrow for the palpebral conjunctiva, which is, of course, you know, it is formed of stratified columnar cell with goblet cell. Stratified columnar epithelium with goblet cell. The red star, the meibomian glands or the tarsal glands. The blue arrow points to the follicle of the lash. The lash is not present. This is the follicle of this eyelash. These are follicles of the eyelashes here present almost in 2 rows. Now identify the structure. We have this picture for the cornea formed of one area formed of nuclei, and then we have this substantia propria. So we have one layer of nuclei. In contrast to the retina, we have 3 layers of nuclei. So one layer only, it is the cornea. The membrane is pointed by the red-green arrow. Red, it is the Bowman's membrane. The Bowman's, this is the epithelium, and this is the Bowman's membrane. And this is the Decimus membrane, formed of collagen fibers, and this is formed of collagen fibrils. And this is for the keratocytes. And this is for the collagen fibrils, bundles of the collagen fibrils. Okay? Now, this is also one ribbon of nuclei, so it is the cornea, non-keratinized stratified squamous epithelium, and then this is the substantia propria, and this is the decimus membrane formed of collagen fibers, and this is the endothelium, and this is the keratocytes, and this red area is bundles of the collagen fibrils. Bowman's membrane here, pseudophilic homogeneous formed of collagen fibrils. Now we have 3 layers of nuclei. One row, many rows, many rows. So this is the retina. Now here we are lucky because we have here the pigmented choroid. So we can see the arrangement here starting from the choroid. This is the retina, first question, the yellow, green, red arrows. Here we will start by this star. It is denoting the choroid. Here, this star, yellow star denoting the choroid, which is pigmented. And then we have the pigment cell layer of the retina. And then we have this is the outer nuclear layer. So this is the inner nuclear layer. So this is the inner plexiform layer. And this one row of nuclei, these are the ganglion cell layer. So this one row is the ganglion cell layer. You can know the arrangement of the layers by looking for the pigment cell layer or the ganglion cell layer. The ganglion cell layer here is very characteristic, one layer of cell only, so can be seen easily. And then we have the nerve fiber layer formed of the axons of these ganglion cell layers. So this is inner area and this is an outer layer towards the choroid. Now, identify the structure marked by the blue line. All of this is the retina. The depressed spot here, it is called the macula, and fovea is present in its bottom. يبقى إذا الحتة اللي هي السبوت دي اللي هي هيبقى لونها يلو اسمها macula لأن فيها كاروتين كتير. And then the depression في البوتوم بتاعها is called fovea centralis. The yellow arrow points to the, here we have at the side of the retina. So this area is rods and cones layer. Now we have pigment cell layer, we have choroid here. So this is the choroid and these are the blood vessels, blood capillaries here, because this layer is characterized by being vascular and pigmented. So the yellow arrow points to the rods and cones layer, while the green star points to the outer nuclear layer, and then we have the red star denotes the choroid, which is rich in blood vessels. Okay. Now I will move to the ear. We have the organ of Corti. Organ of Corti is present in this room, which is called the scala media or cochlear duct. Identify the structure. It is the organ of Corti. The cells pointed by the yellow, black, green. Here, first of all, you should look for the tectorial membrane. The tectorial membrane here has an opening towards the outer side, or the lateral side, or the outer side. So the opening of this C-shaped, it is towards the outer. Okay? So anything towards the concavity is the inner, anything towards the opening of the C is the outer. So this is the tectorial membrane, this is the scala media, and these cells. Here these cells, 3 rows, so they are outer hair cells. And this is 1 row, so this is inner hair cell. And this is the pillar cell, the nucleus is at the base. The pillar cell, the nucleus at the base, so this is outer pillar cell, and this is inner pillar cell, inner hair cell, tectorial membrane. And these are phalangeal, so they are outer phalangeal cell. Now this is the base of the triangle in this cochlear duct formed of the stria vascularis. It's an epithelium characterized by having blood vessel. Now starting also we have this basal membrane اللي هو at the base of this organ of Corti, and this is the vestibular membrane. The cells pointed by the yellow, it is the inner hair cell, black outer hair cell, green outer phalangeal cell, red outer pillar cell, arrowhead tectorial membrane. The curved arrow here points to stria vascularis, which is a specialized type of epithelium as it encloses blood vessels. The space is denoted by 1 and 2. This is the scala media. And this is the vestibular membrane. So this is scala vestibuli. And here will be the scala tympani. يبقى البازلر membrane, vestibular membrane, scala media, scala vestibuli, scala tympani. The space 1 is filled with endolymph. طبعا والسبيسز دول بالبيريليمف. Now this slide identify the structure organ of Corti. طيب هنا الستار دي it is present in what area or what space? This space is the scala media or cochlear duct. This is the vestibular membrane. So this is the scala vestibuli. Vestibular membrane, scala vestibuli. Basilar membrane, scala tympani. And this is the stria vascularis, special type of epithelium characterized by having blood vessels inside. Now, this is the basilar membrane, and these are pillar cells. Look at the tectorial membrane. This is the C and this is the opening of the C, so this is the outer part. These cells, the outer hair cells. These cells, the outer phalangeal cells. This cell is outer pillar cell. This cell, inner pillar cell. The nuclei of the pillar cells are at the base over the basilar membrane. And these are the inner hair cell and the inner phalangeal cell. Thank you very much. Best wishes for all of you.